Today we're going to talk about some of the common symptoms that you'd have with back pain, some of the actual causes of back pain, and it's important to understand the difference between the both, and then more about emergency, or a little bit about emergency situations. So there are certain symptoms that if you have those, you should go straight to the hospital to get that checked out, so those can be quite severe. And then we're going to talk about our approach to back pain and how we treat back pain as well. So first of all, back pain itself as a problem, it affects about 80% of the population. So chances are someone you know or yourself are going to have back pain at some point in the future. So it's important to be aware of these things. And on our website, we do have various areas that will give you some helpful tips and stretches and that sort of thing to help prevent back pain as much as possible. But unfortunately, it's likely to happen to you, or 4 out of 5 of you watching this. So you need to know that. The other thing to bear in mind is the longer back pain goes on and you're off work. Office for National Statistics found in 2015-16 that the longer someone is off work, the more difficulty they have coming back to work. And that's partially due to when you've got back pain, you're bedbound in some cases, or you're significantly less active because of the pain, and the core stability starts to go. You lose muscle tone, which is the thing that's supporting and stabilizing your back. So you get recurrent and extra injuries on top of that. So it really does negatively affect the ability of the back to heal. So staying on top of it, getting it seen to sooner rather than later is always more important, and prevention as ever is better than a cure. In terms of symptoms that one might experience, typically muscle pain, symptoms in the lower back locally, symptoms into the glutes, so the buttocks, around to the groin on the front, and commonly down the leg into the foot. That's sometimes coined sciatica. In reality, sciatica is a little bit different. It's a very specific issue and is separate to just general pain down the leg. That can be a number of different things, not just back pain. In terms of the causes of this, sciatica is one of those curious ones in that I would personally say it's more of a symptom than an actual problem. Something is causing the sciatica, something is injured, pressing on the nerve, there's inflammation pressing on the sciatic nerve, giving that sciatic pain. So it's more of a symptom, in my opinion, than a cause. Causes are things like spondylosis and arthritis, which is degeneration and wear and tear of the discs or spinal structure itself in the lower back. Commonly it affects L4, 5 and L5S1, the lower segments in the lower back, and that's because we're spending more and more hours daily sat at a desk. And when you're sitting down, just bear in mind, even if you've got perfect posture, which most of us don't have, you're putting about 20% more pressure through those lower discs than they are designed to take when you're in an upright position. Coupled with the fact that most of us don't walk around properly in a good upright position, you're just magnifying that wear and tear. And head posture does come into that, especially with the lower back disc, quite a lot. Moving on to things like trapped nerves. So again, that's some irritation or injury causing inflammation, pressing on a nerve in and around the lower back. Sometimes this is quite local pain, other times it can radiate out to other areas of the lower back or the buttocks. You also have stenosis. Now stenosis is where the bony canal gets smaller, and that can be because of wear and tear, it can be because of a trauma, it can be because of some more sinister things like a break in the spine, which hopefully you don't ever have, touch wood. But stenosis, in many cases, is just a degenerative thing. And it means that you're more likely, should a little bit of inflammation build up, to get symptoms in the back. And it's important to regulate that inflammation, take it down as much as possible, and promote healing in the area to make sure that those tissues are as healthy as possible. Discs, they're a big one. Now, slip disc is a term that's bandied around a lot, and a lot of people have quote unquote slip discs. What this means in reality is that there is something wrong with your disc. The discs don't actually slip. And the problems that a slip disc refers to when your medical practitioner says you have a slip disc are on a massive sliding scale, from very, very insignificant to very severe. And some of those can result in the symptoms that I'm about to talk about with regards to an emergency. Slip disc can mean herniated disc, it can mean inflamed disc, it can mean bulging disc as well. It's important to understand exactly which one it is, so that you can provide the right treatment, the right recommendations, which may not be treatment from someone like myself or us at the Mayfair Clinic. It may mean surgery in some cases, or it may just mean go home and rest it. So it's important to understand exactly what type of slip disc you do have. The serious symptoms for which you do need to go and see someone about is if you ever have any saddle anesthesia. And what this means is the area of your body that would be in contact with a saddle should you be riding a horse, if that goes numb or you get loss of sensation there, accompanied with odd feverish symptoms or without those feverish symptoms, loss of bladder and bowel control in response to something like a trauma, or even for no reason, you need to get that checked out immediately. So head straight over to your A&E and explain the symptoms, and they will do or should do the necessary investigations. But that's not something you'd go and see someone like us for, or if you did, we would send you straight there. Just to be safe, it's always best to be safe. In terms of actually treating the back pain, so assuming you're not one of the very few cases that do have a medical emergency with regards to your back pain, we can do a lot to really help the back pain. Our main goal is to actually firstly identify what the cause is, not what the symptoms are. As I mentioned earlier, a muscle strain is not a diagnosis. It's a reaction to something that we need to get to the bottom of if we're going to heal it with good success. Often back pain is misdiagnosed as a muscle strain, and that's not the case. When we're treating the back pain, we're working to reduce the inflammation, reduce the pain and reduce the swelling, get more blood flow to the area to help the tissue start to heal, and also increasing the cellular activity in those tissues, be them the injured disc, be them the injured facet joints, be them a strained ligament in the lower back, to get them to heal properly so that you get complete tissue resolution and start to feel better. So that's really what we do. We also do refer for x-rays and MRIs in certain cases and have an element of rehabilitation, because that is very, very important. It's all well and good us healing those structures first and foremost and getting you feeling better, but we want to make sure that you have the tools to not get it again where possible. So that may mean specific exercise rehabilitation, which is informed by a full structural analysis of your spine to understand exactly what exercises are good for you, and more importantly, what exercises or activities you shouldn't be doing. Sometimes cycling is not the best thing for you, in other cases it is. Sometimes you shouldn't do sit-ups and crunches, and sometimes it's not a problem for you. We do thorough examination to make sure that we can make the right recommendations, and that your rehabilitation exercises that you can do at home or at the gym are appropriate for you and in your best interest, and things that you can use indefinitely into the future to make sure you stay healthy. So if you have got any questions about how we could help you with back pain, want some advice, first and foremost, if you've just had back pain, look on our website, because we've got some great self-help tips. Reach out and message us on social media. It's the easiest, fastest way to do that. We have it all the time. We're very, very responsive on there, so we can give you some good advice. And if we need to, come into the clinic and see us, and we'll get treatment, because with these things, especially back pain, treating it sooner saves a lot of time and energy, and invariably you get way better results if you catch it early.